So, bună ziua. Hello, everyone. Thank you, Global Medcare, for your invitation, and thank you all for your presence today. It's an honor to me to be here and have the opportunity to share my experience with both Liftera and Coolfase. Let me introduce myself. My name is Maria Cristina Arci. I'm a Brazilian dermatologist and I'm specialized in aesthetics medicine. I've been working now with Liftera and Coolfase for more than 6 years. And here I was one of the first doctors to start to work with it in Brazil, but now we have hundreds, maybe thousands of Liftera users and Liftera lovers. So I hope today I will be able to show you the reason behind this huge success in Brazil. So let's get started. My today's agenda. I will briefly review with you some details on technology, anatomy key points, and then we are talking about application protocols and my personal approach, my experience, and show you some results. Here about technology, so it works very similar when we compare to other HIFU systems, but it has its special detail that I'm going to tell you. So here we have this ultrasound transducer inside our cartridge, and it's responsible to generate our ultrasound waves. It will induce a vibration in the molecules of this tissue, and this vibration generates heats. And here we have a selective thermocoagulative change that we will name TCP. So here we have thermocoagulation point. And what is the goal of our treatment? What are the targets we want to achieve? So we have here dermis, subcutaneous tissue, and obviously is mass. So here, Liftera is a device designed to deliver this focus energy in a specific skin layer. And this tissue damage results, of course, in a contraction. And this contraction will initiate a repair process with new collagenesis. That's all we want. And here, so why Liftera is so special? Here it's what I try to explain to my patient when he asks me about why those older HIFU systems, they were so painful and Liftera now much better. So this is the reason why. Here we have this special technology. It's called, I will show you here, Digital Power Unity. So this UDP is responsible for this effect. Let me show you here. When we have Liftera, you see we have ideal shots because it generates the energy only in this focus point. When we compare to other devices, the analog HIFU systems, so we have this uncontrolled heating, and this is responsible for more pain, it's responsible for more risks, so this is a big difference. And when we see here UDP technology, so it's a physics principle, we have here in Liftera, it is much more precise because we have this full power delivered at the focus point. We only maintain the fundamental frequency. And other devices, other HIFU systems, they include all these harmonic distortions, so the power is much more dissipated. Perfect. So we understood technology now. We can move on with some anatomy details. Of course, here we are all doctors. We already know anatomy, but I would like to reinforce with you some key points that will help us to understand how I achieve better results with my protocols. So basically, when we understand that the aging, it doesn't affect only our superficial skin. It starts in the bones, it starts with fat pad atrophy, it starts with repositioning, changes in ligaments, changes in muscles, and then finally we have this thickening or this thinning of the skin. So how to treat it? We need a device that is able to treat all these skin layers. So basically I will start with dermis, and we have some studies that will help us to guide us during the treatment. Basically, dermis, my main transducer is 1.5 millimeters. And here you see the depth, the thickness of our skin is around 1.3, 1.6 millimeters. So it makes sense to use a 1.5 transducer here to stimulate the dermis. Then we go to the subdermis, which is our subcutaneous tissue. And here we know how it's important to treat this region, since our aging process is associated with this volume shift within the superficial fat tissue. So we know here we have an atrophy of this anterior part, and here an increase of the jaw, an increase in this lower compartment. So Liftera is able to provide this sculpting effect when this fat tissue is target. And we can't forget that is important in this layer, we can have like a thickness thickening of the fibroceptor in the fat layer. So this is how important it is to treat this layer. And finally, last but not least, we have SMAS, which is this network, this fibrous network that cover all our face muscles. And this is important to achieve our non-invasive skin lifting. And to achieve this, we have to stimulate basically our SMAS here and our superficial temporal fascia. SMAS, of course, as I've told you, we are going to use 4.5 transducer, but here in the temple area, we have to remember we have the temple nerve, and sometimes this area is already reduced. So we don't want to have a fat tissue decrease in this region. So for this reason, I usually use 1.5 millimeter here in the temples, in some cases 3 millimeters, as I will show you soon. And here is a very interesting study to understand how can we target this mass, and here how its depth varies. It increases with BMI, it decreases with advancing age. And another important information, you see how we can target mass here, because it's 4.82 millimeters, 4.25 millimeters. So we target it with the 4.5 transducer. But here in this neck region, you see how this skin is thinner. So here I will treat it with the 1.5 or 3 millimeter transducer. Perfect. So now we can move on. And this is another interesting analysis, because here we have a histological analysis. And when we check this alignment of the fibers of our SMAS, we see here how they are almost parallel to the skin. So when Liftera acts on this SMAS, what do we have? We have a contraction of these fibers, and then we have the expected lifting effect. So this is how important it is to treat this posterior area to have our result. And of course, the ligament line, everybody knows here about it, and we know how they are important as an anchorage point, and this will support the skin, this will support all our subcutaneous tissue. So it's an important area when we are treating to focus our shots in this ligament line. And of course, here we have a new definition of this ligament, because we exclude the mandibular ligament here that is anterior, and we draw like a line that it comes from the lateral orbital area, and it goes to this jawline, and it functionally divides this fixed face posterior and the mobile face anterior. In this concept, we already use it to the fillers, right? We know when we start to fill this region before, we need less volume here in this anterior part. So this is a very interesting concept to use when we are performing technologies, when we are performing our energy-based devices. So I use more shots in this region, and just for doing that, I get an increase, improvement of this contour, improvement in the nasolabial fold. So it's a strategy that we are going to use in our treatments. And to finally end this anatomy review, I want to show you this lateral orbital thickening. because here you have the orbital ligament, and here our superficial temporal fascia, and this when they meet here, this thickening is important to stimulate with Liftera, because when we concentrate more energy here, when we concentrate more shots, we have a better result. We have this lifting effect, as I will show you ahead. The risk areas we already know, but it's always important to remember. These are the areas, I've told you the areas that we want to target, and now the no-go areas, the areas that we want to avoid. So here, what's important to understand? The sensory nerves, the motor nerves, especially here the marginal mandibular branch. Temples, as I've told you, we have to select the right transducer. The eye sockets, glabella and thyroid, I will only use the 1.5 transducer, not the deeper ones. And here, I will just show you the nerves. Here, the most important marginal mandibular branch, and here the sensory nerves, supratrochlear, supraorbital, and infraorbital. So these ones I'm going to treat only with 1.5 transducer. So here is how I perform my marking. You see here, 2 centimeters from the oral commissure is the safe zone to work with Liftera. And now the indications, you can imagine, as a HIFU system, Liftera is able to treat mild to moderate skin laxity. So here is very important to align our patients' expectations, because it's a non-invasive procedure. So you can expect like plastic surgery. That's not our mission here, but it improves laxity, facial and body contour, skin quality, wrinkles and fine lines, and of course vulvar rejuvenation. I don't know if anyone here treats this area. Anyone? No? I know sometimes it's difficult for us as a dermatologist to deal with this question, but when you talk to your patient, sometimes it's a good education, and Liftera works very, very well into this region. And here, contraindications, so pacemakers, metal implants, pregnancy, active skin infections, permanent fillers. And here, unstable medical conditions. Here we have relative conditions. So if it's an autoimmune disease, for example, and it's controlled, I can perform my Liftera with no problems. And keloids, maybe hypertrophic scars, we have to analyze it case by case. And here it's what we never want, adverse effects. Edema in erythema is actually an expected effect, so it's normal, and it's usually very, it quickly is resolved. But mild pain, almost no pain, maybe with the 4.5 line, you can, your patient can feel a little, but very little. Bruising, paralysis, and scarring. This is related to inadequate application, so you have to remember there is a thin layer of gel and not use too high energy levels. This is how we can protect our skin. And other than this, we have seen some articles now with eye injuries, catarata, glaucoma, and this because there is no adequate application. We can applicate here right over the eye. All these cases were performed by other professionals, no doctors, so it's something that we have to be aware of. And finally, our Liftera application. So here I want to give you some tips on how I do it, my personal approach to achieve these results. Liftera, does anyone here has already Liftera? Oh, really nice, very good. One there, great. So you know all the transducers. And here we have pen applicator and line applicator, a line applicator with all these depths. And with the pen is a very innovative applicator because its ergonomics, it can really optimize our results. So you have like this treatment of curve areas. You use your moving technique to refine your treatment, to deliver more energy to specific areas such as the ligament line, as I told you, and such as this area, the periocular thickening. So are areas that you have to concentrate more energy to have a better result again. And here it how the pen works. You can see, I don't know if the light will allow you to see, but they are small dots. It is very precise, the pen, and you can have this flexibility to treat the curve areas with more precise TCPs. It's only delivered here in the center of our contact surface. And with the line applicators, here it's a little bit different because here you have to do it in a static mode, not moving only with the pen, and here a static mode. And you need to align your transducer most perpendicular to the surface and try to maintain this spacing, avoiding overlapping. What I recommend to you, 3 to 5 millimeters. And here another tip that I find that is very interesting you to know. That's why I always fix my spacing of 1.5 millimeters, because then you are able to deliver more TCPs. So if you leave here 1.5 millimeters, you have 17 TCPs. And with the pen, you can use the speed up to 10 Hertz. So I always use the maximum 10 Hertz. And if I want a more aggressive treatment, what I have to do? I select 10 Hertz and I move my hand very slowly, so then I can concentrate more energy at the same time. So this is a very good strategy. And here I'm going to show you how I will perform my marking for this device. So you see, I'm just marking the risky areas. Again, supratrochlear, supraorbital, infraorbital. In this region, only 1.5 transducer. And here, 2 centimeters from my oral commissure, I have the marginal branch, mandibular marginal branch. So I have to take care. And then we are ready to start. Remember, a very thin layer of gel is necessary to treat it. And here is something I add to this presentation. I prepare like a diagram to make it easier to you, maybe someone that is at the beginning and you don't know how to start it or how to choose a protocol, you can try to use these tips. So basically, here, line, we have 17 TCPs per shot, as I've showed you, and with the pen, we have 1 TCP per shot. So in a square, we can draw a square in our face, and it measures 25 millimeters by 25 millimeters, and inside this square we have 10 to 20 line shots. So then you can have an idea of the total shots that you are going to need to treat it. And if you use lines, so for example, if you are going to use 10 lines inside this square, you can convert it by multiplying by 20. So if you multiply by 20, just to make the math easier, you could multiply by 17, but when I'm in front of my patient, I want to be faster, so I multiply by 20, and then I'll have 200 pen. So if I perform 20 lines, I'll have 400 pen, for example. And now my protocols, so you see the company protocols, they are different, and each professional has its own protocol. So here what I want is to share my experience with you, what I've seen through these last 6 years and what I do think it works better. And what I do is divide my faces. So for a skinny face with more skin laxity, what I want is to stimulate neocollagenesis across the entire face, but what I don't want to decrease this adipose tissue. Sometimes when I receive a patient in my office, he says to me, "Oh, my previous doctor said I cannot perform any HIFU system because I have a very skinny face, and this will generate a decrease of my adipose tissue, and then my face, I will have like a melting face because of this laxity, but this is not true. What you have to know is that you have to know how to use the technology, the machine that you have, and then you will have safe and good results. So basically here, my protocol depth guidelines for this kind of face, I will use my 4.5 transducer only posterior to my ligament line, and here only pen transducer. You see here my 3 millimeters. Sometimes I can advance here to my anterior malar region, but when the patient is too skinny, we already have like an atrophy here in this area, I won't use neither the 3 millimeters. So only 4.5 here, posterior to the ligament line, and here 3 millimeters again. And 1.5 is the most important transducer. These I'm going to use more shots actually to target these areas. I can treat temporal, I can treat my lateral forehead, I can treat jaw. It's safe to treat all my face. And here, if you want to take pictures, this is my personal protocol that I've been using in the last years. And as you see, skin laxity, when it's this skinny face, I don't want to have this decrease of my tissue, of my fatty tissue, so I don't apply the 4.5 line. And I start with 4.5 pen, but only, again, posterior to the ligament. And here I will perform 400 to 800 shots per side, and then I move on to my 3.0 line. You see, I will combine line and pen transducer. So here I will start with line 3.0 with 60 shots per side, and then I go with my 3.0 pen with 600 shots per side. And again with the line and pen 1.5, which for this kind of patient is the most important transducer. So that's why here I'm choosing to do 2,000 to 2,400 shots in this kind of patient. And here I'm going to show you how I can perform this application. So of course it's an accelerated video, but it's just so you can have an idea. I draw that line again, and with my 4.5 pen, I just treat right above my ligament line and this posterior part of my face. And this is the pen. You can see how it's very fast to treat it with it, and always using this movement technique. And of course I will do the 3.0 transducer, but here's an example of my 1.5 transducer, because here I can treat all over my face. There is no go area here. We are safe, so I treat my jawline. I will treat here, and let me see if I can stop it. I don't know if I can do it. Let me see. I just want to show. Oh no, it's coming back. I will show yeah, you can try. I just want to show you, because what you told is very interesting. I actually do this in my practice. I treat just one side before, and then I show to my patient so he can see like that wow effect. That is like a Cinderella effect here, because here is just because Liftera generates a heating, so we have like a contraction of these fibers. But then after 1 month, 2 months, we have like new collagenesis, and it starts like at the end of the video. Let me put it here. Maybe here. You can see from there. So here, the first side, this is the side I've treated, and here the no treated side. So you can see this difference. We have the contraction, we have the skin tightening, we have the skin lifting. So that's what all our patients want, because they just want a non-invasive procedure with no pain, with no downtime. They leave our office and they are ready for a party, for their new appointments. So this is how I believe technology and energy-based devices, they are the present, they are the future of these aging treatments. Perfect. Yes. So now my last protocol. The second protocol is for a round face or heavy face. So here we do want to have like this slimming effect. And so this is how it's important to treat also the contour, the facial contour. So here my tip is to use the 4.5 transducer all over our face. So treat this lateral area, and then we go with the 3 millimeter transducer again, all lateral area of our face. And here we can go up. We can treat the lateral forehead and even the temple if the skin is not that thin. Okay, and then we go with the 3 millimeters, the 1.5 transducer, and it's always important to treat the double chin. So here we are going to treat the submental, the submandibular area. Why? Because here we are going to improve, of course, our face contour, and here we can use depths more than 4.5 millimeters, especially here. So you can use 10 millimeters, you can use 13 millimeters, and then you are going to target here the undesired fat tissue in this area. Right, so here is the protocol. You're going to see that it's different from the previous one, because here I want to spend more shots. Let me come, yes, now. Why it's different? Because here I want to use my line 4.5. Did you understand the difference? Here I want to use it, and I will give like 60 shots per side, and then I go with the pen 600, then again 60 with my line 3.0, and then 800 with a 3.0 pen. And we also can perform the pen 1.5, but here usually I don't use the line, so then I compensate, because here we have that heavy face that we want to treat. And again, how we do it, this video is very accelerated, but here we have like a static mode, okay? It has to be static, but here is very accelerated, so you can see how the application is. And here's my pen, my 4.5 pen, then I change it to the 3.0 line, like a static mode, and cover all this, the area that I want to treat. And to treat the periorbital region, you see I can go right above the eye, so I treat this eyelid, the inferior eyelid, and with 1.5 I can treat everything, including jaw, including temples, so it's very safe to use the 1.5 pen. And finally, we have the protocol for this area, the double chin. To treat this area, remember we can use deeper transducers, so 7 millimeters, 10 millimeters, and then I continue. So I use 40 shots of the line 4.5, 800 shots of the 4.5 pen, and then it moves on until I finish this treatment. And here you see how I perform the application with the line. Here is very important, the patient position, because if he is seated like this, you're going to use your handpiece at the opposite side, so it's not delivering any energy. So it's very important to remember that he has to be laid down. You ask him to up his chin, and then you're going to treat most perpendicular possible, or even oblique. And here you have the treatment, the post treatment. And here it's what I told you. I like to show you this because when I treat one side and the other side is not treated, the patient can see this difference, so I think it's very interesting to do this. In other case here, it almost seems like she got fillers here, but no, it's just this effect, the tissue repositioning that we can get with Liftera. And these results, we keep seeing them. I think here, and I always like to repeat this sentence. Let me show you the side view as well. You can see the improvement of our face contour, reduction here of the double chin, tissue repositioning, this lifting effect. And again, of course, I'm a technology lover, but you have to understand now that we are in a new era of this aging treatment. It's not only trying to treat the consequence, because Of course, botulinum toxin, fillers, they do it very well. We need it, but now we need to start to treat the cause of this aging. We need to stimulate collagen, new collagenesis, and this is what Liftera and Coolfase that I'm going to talk with you after are going to do. So I think this is very well related to a new concept of quiet beauty. Not too much fillers, not too much volume in our faces, but like natural results. And this is another case. You can see improvement of contour, again lifting effect. Other cases here, you have an improvement of this jawline. And even in skinny faces, as I showed you, we can have this kind of result without fat tissue reduction when we know how to do it. And you see this case again, improvement of our contour, improvement here in this nasolabial fold, fine lines, wrinkles, they are all target with Liftera. And there's results, we keep seeing them even after 6 months. And this is another example that you can combine treatments. So here I've done Liftera before, right before and after. You can use a filler, for example, because sometimes we are so afraid to treat this region with fillers because a lot of skin laxity of this area. So we prepare this area with Liftera and then we can use our filler, for example. And it's not the focus, so it'll be very quick, but I want to show you some body treatments. That is another very good indication with Liftera. And here, a tip that I can give to you is to use this kind of adipometer. It's a tool. And when we divide this measurement by 2, we have the thickness of the fat tissue. So here, basically, what I prepared to you, so it makes it easier to understand. If this skin fold measured by the adipometer is 10 millimeters, we can use the 4.5 transducer. If it's 20 millimeters, we can use the 10 millimeters transducer. So here, if it's 15, for example, the measurement, we can use the 7 millimeter transducer. So this will help you to choose the right transducer. And here you're going to use line or pen. Basically, these are some grids that we already developed to help you. But here for the body is a little bit different. Inside each one of these boxes, you can use 5 to 10 shots. So basically, with this grid, you are going to use 60 to 120 shots, for example. And the line again, static mode, movement technique with the pen. And here some examples how we can treat this abdominal area, and finally to show you some results of these body treatments. Here we have localized fat and want to improve this body contour. So this is one example of my protocol. Here just using pen, but as I've showed you, you can convert these shots to the line transducer, for example. And here, after 3 sessions, this is a kind of result we can get with Liftera, a better contour of our body. And last, vulvar laxity, when we want a tightening effect of the skin, but no volume. We could choose biostimulators, fillers. But if she doesn't want that kind of volume, here is another option of treatment for you. This is the protocol with 3, 2, and 1.5 transducer. Here, if you don't have 2 millimeters, you can convert it to the 1.5, like 700 per transducer, 750. And this is the final result. So you see, right after the procedure, we have that Cinderella effect because of the contraction of the skin. But after 2 sessions, you see how it's improved. So we have skin tightening and a better skin quality. So thank you very much. Mulțumesc. And here's just to invite you for my next presentation that will be at the end of our session. So I hope you all be here. Thank you.